Hi, I'm Faith Billings. I'm going to be your nurse today. I noticed that you are a new patient of Dr. Patel's, so in order to get a better understanding of you and your health needs, I just have to do a physical assessment on you, and I'll just look from head to toe and assess and make sure that everything is working properly. Do you have any questions for me before we start?
No, I'm good.
Okay, so I'm going to be assessing your musculoskeletal system. So, do you have any problems with your joints? Any pain anywhere in your joints?
No.
Okay. What about in your muscles? Do you have any muscle pain?
No.
Okay. What about bone pain? Do you have any bone pain at all?
Nope.
Okay. Do you take any medications like Aleve or ibuprofen or any type of anti-inflammatory or pain medications?
No.
Okay. Good. Now I'm going to be looking at your joints. I'm going to be making sure that your joints are symmetric and they're moving freely and you don't have any lumps or bumps anywhere and you don't have any inflammation. Okay?
Okay.
So I'm going to have you lift those up. I'm just going to feel them. All right. They're symmetric, no heat, no lumps or bumps that I noticed there. I'm going to look at your wrist. Again, I'm looking for the same things that I would be looking for, that I looked for previously. Okay? And your hand joints. Good. All right, they are symmetric, no inflammation, no lumps or bumps there. All right, I'm looking at your knee joints here. No lumps, bumps. Feels nice and cool. They're not hot or feel like they're inflamed. I'll look at your ankles. All right. Same. They're equal, symmetric, no inflammation anywhere. Looking at your feet joints. Good. No asymmetry, no heat, no lumps or bumps. Now I'm going to be assessing your range of motion. So I'm just going to make sure that your muscles and joints and tendons and ligaments are all going to be moving freely through a different range of motion. Okay? So first we're going to do your shoulders. I'm going to ask you to shrug your shoulders up and down. Good. And then I want you to just roll your shoulders forward and then backwards. Okay? I'm going to feel, okay, do it backwards. Good. Okay, now I'm going to look at your range of motion in your elbows. I'm going to have you extend and then pull up. Okay? Good. There's no crepitus. They're moving freely. Good. And then I'm going to have you rotate your wrists in a circle. All right, now I am going to look at your range of motion of your knees and your feet. Okay?
Okay.
So I'm going to have you kind of kick your leg out like this. And I'm just looking at your range of motion of your knee joint. Okay, look at the other one. Good, nice and symmetric. No pain with that?
Nope.
Okay. And I'm going to have you kind of twist your ankle around and roll it. Good, any pain with that?
Nope.
Okay, do the other one. Good, now I'm actually going to have you stand up. And I want you to take your hip and I want you to flex it out and then in. Okay, good. Any pain?
Nope.
Okay, I'm going to have you do it with the other leg. Out and then in. Good. All right, you can go ahead and sit back down. And then I'm also going to move on to your spine. I want to look at your range of motion in your spine. So I'm actually going to have you stand up again. And I want you to bend down and touch your toes. And I'm just going to look at your spine. All right, nice and straight. Okay, you can go ahead and stand back up. Does that hurt at all when you do that?
Nope.
Okay, I'm going to have you sit down. And I'm going to have you bend side to side. And I'm just checking the range of motion there. Okay, good. Any pain with that?
Nope.
Okay, now I'm going to have you bend backwards, which is kind of hard in the chair that you're in. So if you want to kind of
I'll turn this.
turn it and then bend backwards for me. Yeah, that's good. Any pain?
Nope.
Okay. And then I will have you kind of twist to the side like that to each side. Okay? Any pain?
Nope.
Okay, I had a little bit of a crack. That's pretty normal. Most people's backs are kind of tight and they need a little bit of popping. So I'm also going to assess your cervical spine, which is like your neck. So I'm going to actually have you turn around in the chair, and I'm going to have you bend your neck forward for me. I'm just feeling the spine. It's nice and straight. Okay, you can turn back towards me. Okay. And I'm also looking at you just as you're looking at me. Your head's nice and straight, proportionate to your body. You know, it's not bending one way or the other. I'm going to have you actually press my hand to the side. Yeah. And then there. And then now I'm going to have you rotate it side to side. Good. And then all around. Circular motion. Good. Yes, a little bit of cracking there. That's okay as long as it's not causing you any pain. All right. Do you have any questions for me about the range of motion of your joints, or how anything about your joint or bone health?
No.
Okay. How much milk do you drink? Do you drink plenty of milk?
Yes.
Okay. Do you feel like you get plenty of calcium in your meals?
Yes.
Okay. So I'm just going to do a little education. Even though you say that you drink plenty of milk and get plenty of calcium, it's always good to make sure that we're protecting our bones. So just make sure that you are, intaking enough calcium to help bone growth. Okay?
Okay.
All right. So now I'm moving on to assessing your lungs and your chest, okay, or your thorax is also called. So what I'm looking for in your thorax is your anterior posterior diameter and your transverse diameter, which the anterior posterior diameter should be less than the transverse diameter. It should be 1.2 to 5.7, which I'm just going to have you take a deep breath and let it out. And I'm just looking, so the anterior posterior is the expansion here, and then the transverse diameter is just this diameter. Okay.
Okay.
But your expansion looks normal. I don't see any unequalness in your breathing. Both chest walls, each side of your chest move in symmetry. I'm also going to be assessing for tactile firmitis. So I'm going to use my hands, and I'm going to feel in between your lung spaces as you say 99, and I should be able to feel the vibration equally throughout all of your quadrants, okay? And so this is going to help me make sure that your lungs aren't suppressed in any area, or you don't have anything weird going on, okay?
Okay.
So, let me see here. We start up here, say 99.
99.
Good.
99.
Okay.
99. 99. 99.
Okay. And now I'm going to have you go around. Yep. You just want to rotate and sit up straight for me. Okay.
99. 99. 99. 99. 99. 99.
Okay. You can go ahead and turn around. They were both equal. Everything sounded nice. I could feel the vibrations throughout all of your chest, so that's good. And then I'm also going to percuss your lung fields, which just means that I'm going to tap on it, and I'm listening for the sound. I'm making sure that you don't have any places that feel really dull, like you have buildup of fluid or some sort of tumor or nodule or something like that, okay? So let me turn around again. Okay. Can you scoot forward a little bit? Okay, good. It's kind of hard with you wearing a short there, but it'll work. So everything sounds good. You don't have anything to worry about there.
Awesome.
Okay. Now, as far as lung history, do you have any shortness of breath?
Nope.
No. Any cough or fever?
No.
Okay. Do you take, you don't take any medications for a cough or anything like
No.
that? Do you use any inhalers
Nope.
or have a history of asthma?
No.
Okay. Do you work in an environment that would put you at risk for lung issues like inhaling smoke or chemicals or anything like that?
Nope.
Okay. So I am going to do a little bit of education for you. You don't smoke, or you don't smoke, so that's
No.
good. I recommend not ever starting to smoke. That can really, really hurt your lungs. And what about secondhand smoke? Are you exposed to secondhand smoke at all?
No.
Okay, good. So again, make sure that you are protecting your lungs. Anytime you're around chemicals or working with high toxic fumes, make sure you're wearing a mask. Okay?
Okay.
Now I'm going to take a listen to your lungs, and I'm going to make sure that they sound clear and make sure it doesn't sound like you have any fluid buildup or anything like that. Okay?
Okay.
Okay. And I'll tell you when to take a breath and to let it out.
Okay.
Okay. Deep breath. Okay, your front of your lungs sound wonderful. They're nice and clear. I don't hear any abnormalities there. Okay, so now I'm going to have you turn around for me. And I'm going to listen to the back of your lungs. Deep breath. Okay, awesome. Your lungs sounded wonderful, nice and clear, and that's what we want, okay?
Great.
So now I'm going to be moving on to assessing your heart. I am just going to make sure that everything is working properly there. I'm going to ask you some health history information. Do you have any swelling in your body, like particularly in your lower legs at all?
No.
Okay. What about, I already kind of asked you about shortness of breath, which you said you don't have any, so that's good. What about when you're laying flat?
I have no problem.
Okay. Do you ever get palpitations, like your heart is racing, or you feel like your heart skipped a beat or anything like that?
No.
Okay. And I noticed that you have good color. Do your hands or feet ever get blue colored or purplish?
Nope.
Okay. All right. So it sounds like you're in pretty good cardiac health. And I'm just going to do a little bit of assessment to double check. Okay?
Awesome.
So first I'm going to palpate, which means feel your apical impulse. This is the point of maximal effort of your heart. So I'm just going to have you take a deep breath, and I'm just going to feel it, okay? I'll tell you when to take the deep breath, okay?
Yeah.
All right, hold on. It's at the 5th intercostal space. Okay? Take a deep breath. Good. I feel it. It is nice and strong. even symmetric. Okay, it feels like your heartbeat is regular. Okay, so now I'm going to take a listen to your heart. I'm going to be listening to several different places in your heart. Okay, so you have different valves in your heart, and that's what I'm going to be listening to. So you have the aortic valve, the pulmonic valve, the herbs, tricuspid, and mitral valve. Okay, so I am listening to several different places. So it may seem like I'm listening to your heart for a long time. That doesn't mean that anything's wrong. Okay?
Okay.
All right. First, I'm going to start listening to your aortic valve. Okay?
Okay.
Now I'm going to move to your pulmonic valve. And the herbs valve. And the tricuspid valve. And the mitral valve. All right, they all sound great. Sounds nice and strong and even. All right, do you exercise regularly?
Yes.
Okay, how often do you exercise?
3 to 4 times a week.
Okay, and how much of that is cardio, would you say? Do you do cardio every time you work out, or just
every now and again?
Okay. Now it's recommended that you get at least 30 minutes of cardiovascular activity a day. Okay. So if you're not getting that and you're not doing that, make sure that you start doing that. Okay. And that can just be a daily 30-minute walk. It doesn't have to be, some vigorous activity. Just something to get your heart rate up a little bit. Okay.
Okay.
Now I'm gonna be moving on to assessing your abdomen. All right, make sure that everything is working properly there. How's your appetite?
Great.
You have a good appetite?
Yeah, eat a lot.
Okay, good. So you feel like you eat just a regular diet? What do you eat normally?
French fries, pizza.
All right. Well, education for you. Those are not the best foods to be eating. You need to be eating a balanced diet. More vegetables, grains, fruits, you need to spread out your diet, okay? Just eating those foods. It's okay to eat carbs, but not an abundance, okay?
Okay.
All right. How's your swallowing? Do you have any problems swallowing?
No.
Okay. Any issues with nausea or vomiting?
No.
Okay. What about abdomen pain? Does your belly hurt ever?
No.
Okay. Any history of like abdominal surgeries or anything of that nature?
Nope.
Okay. So it sounds like you're pretty healthy.
I try.
Besides your diet, which we talked about.
Yeah.
So now I'm going to be looking at the contour of your belly. It shows how somebody's nutritional state. So I'm going to kind of stand on the side of you. I'm going to have you scoot the chair that way a little bit though. Okay. And I'm going to have to ask you to lift your shirt up just a little bit. Okay? So I'm going to kind of crouch down a little bit. I'm looking above the abdomen and sit up straight for me. And I'm just looking to make sure that it's not like your stomach's not severely indented or severely bloated. And yours looks fine. Okay?
Right.
So now I'm going to stand up. You can scoot back to where you were. Now I'm going to listen to your bowel sounds. So your bowels have 4 quadrants, and I'm going to be listening to each of those.
Okay.
Okay? Okay. Sounds good. Your vowels don't sound hyperactive or hypoactive. I'm hearing sounds at least every 3 seconds, so that means that they're normal. Now I'm going to be listening to your vascular sounds in your stomach. So there's several vascular areas in your stomach. I'm going to be listening to the aorta, the right renal artery, the left renal artery, the right iliac artery, and the left iliac artery, and then the right femoral artery and the left femoral artery. Okay?
Okay.
So if you could pull your shirt up a little bit. Thank you. This is the aorta. I'm listening for any bruit or abnormal sound. And then the right renal artery, the left renal artery, the right iliac and the left iliac, and then the right femoral and the left femoral. Good. Now I'm gonna percuss your stomach. So I'm gonna make sure that the sound is evenly distributed and that there's not any, that I'm not feeling any masses or abnormal protrusions, okay? I'm gonna have you lift your shirt up again. Okay, I'm just gonna lightly push around there and you're gonna tell me if you feel any pain, okay? Any pain?
Nope.
Okay. Now I'm going to press a little harder there. Any pain?
Nope.
Okay. And I think I might have said percuss, but I meant palpate, which means feel. Okay?
Okay.
And then now I'm going to percuss your abdominal quadrants, which, like I said, that is listening for sound.
Okay.
Okay, so we'll have you lift up your. Okay. Okay. Any pain with that or anything?
Nope.
Okay. Sounded fine. I didn't hear any abnormal sound. Okay. Now I'm going to be assessing your peripheral vascular system, which is basically just how your blood is flowing to your extremities, and that would be your arms and your legs. Okay.
Okay.
So, are you having any numbness or tingling in your feet or your arms?
Nope.
Or your legs?
No.
Okay. What about leg cramps? Any leg cramps?
Nope.
Okay. Again, I asked you about swelling. We already talked about you haven't experienced any swelling, so that's good. Okay. So now I'm just gonna look at your lower and upper extremities and make sure that everything looks good. Okay.
Okay.
So I'm gonna have you look at your arm here. Your skin is nice and warm. It's not cold. I'm not noticing any cyanosis, which means like blue discoloration, which would be a sign of some vascular blood flow issues or arterial blood flow issues. Your hair is evenly distributed. There's not, any missing hair or anything like that. I'm gonna look at your cap refill. It looks good. It's less than 2 seconds. So basically what I'm doing is touching your finger and I'm making sure that the blood flow returns to that finger, okay? Looking at the other arm, the same thing, nice and warm. Skin tuger is nice. That just means that you're hydrated. Hair is evenly distributed. We'll look at your cap refill. It's nice, less than 2 seconds. Your skin tuber was also, I'll look at that side too. It looks fine. Okay, now I'm gonna go down to your legs and do the same thing. Your hair is nice and evenly distributed. Your skin is nice and warm. You don't have any wounds. You didn't have any wounds on your arms either that I noticed. Your feet are a little cold. That's normal. Some people do have colder feet. Just make sure that you're wearing socks or that you like move your feet often, okay?
Sure.
Especially for sitting. Okay. The same here. Skin is nice and warm except for your feet are cold, a little cold. Skin tutor's good. Your feet, both feet they were. We'll look at your cap refill. It was fine on both feet. Okay?
Okay.
So now I'm going to be assessing your pulses. Make sure that they're even, they're strong, and I'm not feeling any skipped heartbeats or irregular heartbeat. Okay?
Sure.
So first I'm going to do your radial. Good. Brachial. Good. Do it on the other. Okay. Good. Nice and strong and even on both sides. There wasn't any irregularity that I felt. And I'm going to move on to your legs here. You have actually several places where you can feel a heartbeat in the legs, okay? The first one is, so you can actually feel a femoral heartbeat, which I'm not going to feel on you, but that would just basically be in the groin area. There's actually two that you can feel there on both sides. And then popliteal, which is behind your knee. So I'm going to actually feel that. Okay, that was nice and even and strong. This one nice and even and strong. Okay, then I'm going to move down to your posterior tibial, which is like right behind your ankle. Good, nice and even and strong. Do the other one. Good, nice, even and strong. Now, this one is called the pedal pulse. Good, nice and strong. And nice and strong. So you can actually grade the intensity of somebody's pulse on a scale of 1 to 3. 3 would be like full and bounding. This would be somebody who would be fluid overloaded, which just means that could mean several different things. But yours is nice. It's a 2, which means that it's normal. So yours were all equal and fine there. Now I'm going to do something called a modified Allen's test. So basically it's to make sure that the arteries in your wrist are both working properly. If one artery were to be occluded in your arm, we want to make sure that the other artery would be able to supply your hand with enough oxygen and blood. Okay? So I'm going to occlude both of those arteries with my hand, and then I'm going to have you make your hand into a fist. Do that several times. Okay, you see how your hand is blanching? It's like turning white.
Mm-hmm.
Okay, I'm going to release on one. See, now it turned back to nice pink color. Okay, so now I'm going to do the same thing, but I'm going to release on the other side. Okay, see it changed color there. Now stop. And look, it turned back pink. So we know that it is fine that your body, if for some reason, we know actually that both arteries are supplying your hand just fine. Okay? Do you have any questions for me about your peripheral vascular health?
No.
All right. Now I'm going to be assessing your neurological system. Okay?
Okay.
Do you have any history of tremors?
No.
Any history of seizures?
No.
Okay. Have you ever had been confused or had disorientation?
No.
Okay. What about concussions?
No.
Okay. So it sounds like you're in pretty good neurological health. Good. So now I'm just going to be assessing the different cranial nerves, and I'll tell you which ones I'm assessing. So the first one that I'm going to assess is cranial nerve 1, and that is your sense of smell. Okay?
Okay.
So I'm actually going to have you close your eyes, and then
Okay.
I'm going to close off one of your nostrils, and then I'm going to have you smell something. Okay?
Okay.
So keep your eyes closed, and then I want you to tell me what you smell. Okay?
Okay.
I haven't put it up there yet. Just give me a second.
No, you're all good. I definitely smell coffee.
Yes, good. It is coffee. You did good. So you can open your eyes now. Now I'm going to do cranial nerve V, which is your trigeminal nerve. Okay? So that's in your jaw. So I'm going to have you just up and down with your jaw there. Okay? Now I'm going to, you clench your mouth shut, and I'm going to try to pull your jaw open. I shouldn't be able to do this. Ready? Okay, good. Good job. Okay. Now I'm going to be assessing cranial nerve VII. So this is your facial symmetry. So I'm going to have you give me a big smile. Good. You're nice and symmetric. I'm going to have you close your eyes really tight. Tight. Good. Open them up really wide. Good. Everything is symmetric there. Can you actually move your eyebrows up and down? There you go. That's very good. Now I'm going to have you puff your cheeks out. Okay? Don't let me blow the air out when I push. Okay? Good. That is supposed to happen. Or I'm not supposed to be able to push that air out, so you did good. Now I'm going to be assessing cranial nerve IX and X. So I'm going to actually look at, I'm going to have you open your mouth and say ah. Okay. Normally I'd use a tongue depressor. In these type of circumstances, I don't have a tongue depressor, and I would actually test your gag reflex, but I'm not going to gag you. So.
That's great.
And I don't have a tongue depressor, but normally in these circumstances, I would do that. Okay?
Okay.
And then I'm going to move on to cranial nerve XI. So I'm going to examine the sternomastoid and trapezius muscles for equal size, and then check the strength of them against resistance. So I'm going to ask you to shrug your shoulders. Good. They are nice and strong. And I'm not noticing any muscle spasms or anything like that. So that's awesome. Okay? Now I'm going to be doing cranial nerve XII. So I'm actually going to have you stick your tongue out at me. Good. Stick it out straight. Normal. Good. It's nice and normal. It's not protruding to one side or the other. So I don't notice any problems with that.
Okay.
Okay? Okay. So now I'm going to be assessing your muscle size, strength, and tone. Okay? So I'm going to look at each of your extremities and the muscles in your extremities. Okay? So I'm actually going to have you squeeze my hands and pull me towards you. Good. So you have nice strong muscles there. You were able to pull me towards you. Now I'm going to have you actually push me away. So hold on and then push me away. Good. Good, good, good. So with your arms relaxed, I'm just looking at the tone of your muscles. I should be able to see like a little bit of tone, but not a whole lot, because we don't want your muscles to be rigid when they're relaxed, or when they're supposed to be relaxed. Okay, now I'm gonna have you push me away with your legs. Good. And then I'm gonna have you pull towards yourself. Good. So again, muscles are nice and relaxed when they're supposed to be relaxed, and you had nice strength in your legs because you were able to push me away and pull me towards you. Now I'm gonna have you move your head to the side. Yep, push me away. Good. Do it on that side. Good. You have nice strength. Your neck muscles are nice and relaxed. I don't notice any extra tone, as they should be. Okay, and then I'm also gonna look at your trunk. So I'm actually gonna have you kind of like move to the side. Good. Okay, other side. Good. And let me feel here. Nice and relaxed. Trunk. Okay. So that all looks good. Now I'm going to have you walk on your feet, and I'm going to be looking at your cerebellar function, which coordinates your balance and coordination. Okay, so I'm going to ask you to walk in a straight line with heel to toe. Okay?
Okay.
Okay, that's good. You can sit down. So little bit of unbalance there. That might have been just because you weren't wearing any shoes, which of course help with stability. So just make sure that you are wearing the proper shoes that give you proper support. Okay?
Okay.
Okay, so now I'm going to look at your sensory system. So I'm going to test your ability to feel pain, light touch, and then position sense, and some other things, okay?
Okay.
Okay. So I have a tack right here, and I'm not going to like stab you really hard with it. It's just going to be kind of a light pinprick. And you just tell me what extremity I am putting it on.
Okay.
Okay, so you close your eyes.
Be gentle. My right arm, forearm, left forearm, right upper knee, left upper knee, shoulder, left shoulder, finger, handwriting,
Mm-hmm.
right foot, left calf.
Okay, that's good. Now, I don't have a cotton ball, so I'm just going to use my fingers for the light touch. So again, close your eyes and you tell me where I'm touching you.
Okay. Right shoulder, left forearm, right bicep, left hamstring, ankle, right ankle, left foot.
Good. So now I'm going to move your hand or your leg through a passive range of motion, which means I'm going to move it for you. And then you're going to tell me what side and what extremity is moving.
Okay.
Okay? So you can close your eyes again.
Right leg, right arm, left arm, left leg.
Okay, good. now I'm gonna do something called stereognosis. So I'm gonna test your ability to recognize objects by how they feel, by their form, size, shape, and weight. Okay? So close your eyes.
A pen.
Yeah, that's very, very good. It is a pen. This one's gonna be a little harder, but okay.
This is a mouse to a computer.
Yep, that was very good. Good job. Okay, so now I'm gonna do what we call a graphthesia. So I'm gonna draw letters or numbers and trace them on your back.
Okay.
So you turn around, and then you tell me what letter or number I'm tracing. Okay?
An 8.
Yep.
7.
No. Okay, I'm gonna make it easier.
Yeah.
I'm just gonna do numbers.
Oh, okay.
That
I
was
thought
a-
you were just
that
doing
was a
numbers. My
letter.
bad.
So
Okay.
I'll just do number, okay?
Alright.
So we'll redo that.
1. 5. 8.
Nope.
0.
There was a 0 in there. What? Okay. What's that?
6.
No.
2.
Mm-hmm.
6. 0.
Yeah. Good.
Okay.
Okay. Good job. So there's a little bit of trouble with that. That's not always the easiest thing to do, but for the most part, you did very well.
Awesome.
Okay. So again, going over some health promotion things that we talked about. What did we talk about? Can you remember? Health promotion means just things that I educated you on during our assessment.
Just make sure that I'm eating more healthy and that I'm paying attention to my joints and that there's no pain.
Good. Good job. That sounds great. Do you have any questions for me?
I do not.